This presentation is on ulnar collateral ligament reconstruction, also known as Tommy John surgery. The UCL is located on the medial side of the elbow. The UCL attaches to the humerus and the coronoid process of the ulna. The UCL helps to stabilize the elbow joint. Dr. Frank Jobe was the first surgeon to attempt a UCL surgery. The first UCL reconstruction was done in 1974 to Major League Baseball player Tommy John. Following the first surgery, Dr. Jobe gave Tommy John a 1 in 100 chance of returning to pitching. Following 2 years of rehabilitation, Tommy John returned to the mound in 1976 and competed for another 13 years until his retirement at the age of 46. UCL surgery is a very common procedure among Major League Baseball players, especially pitchers. During the 2000s, an average of 16 people underwent the surgery each year. A record 34 surgeries were completed on Major League Baseball players in 2012. Anyone can attain a UCL injury due to overuse at the elbow joint or trauma to the area. Baseball pitchers have the highest risk of UCL injury due to the overhead twisting motion that throwing a baseball requires. Over time, the tendon begins to wear down and develops small and large tears. Eventually, the ligament becomes overstretched or compromised and can no longer hold the bones together well enough for throwing activities. Symptoms of a UCL injury include pain on the medial side of the elbow where the UCL is located, feeling of instability within the elbow joint, and/or tingling in the pinky and ring finger digits due to irritation of the ulnar nerve where the humerus connects to form the elbow. This area is also known as the funny bone. The only action a UCL injury impedes is a person's ability to throw an object overhead, such as the motion of pitching a baseball or overhead tennis serve. Rarely does a UCL injury affect a person's ability to complete ADLs. It also does not impede a person's ability to do other physical activities such as running, lifting weights, batting during baseball, or other non-throwing activities. The doctor can diagnose a UCL injury based on the patient's personal and health history and physical examination. The valgus stress test can be administered by a physician in order to assess instability at the elbow joint. Pain and a feeling of instability at the elbow joint during the valgus stress test is a positive sign for a UCL injury. This is the best way for a physician to assess the condition of a patient's UCL. Other assessments can be done using X-rays or MRI. Getting a correct diagnosis of UCL injury can be the most difficult part of the treatment process since the provocative and diagnostic tests are not always 100% accurate. The purpose of the valgus stress test at the elbow joint is to assess the integrity of the ulnar collateral ligament. During the test, the patient can be positioned supine, sitting, or in a standing position, with the elbow at approximately 20 degrees of flexion. The therapist palpates the medial joint line and stabilizes the distal humerus with one hand and applying a valgus stress test to the elbow with the other hand. A positive sign for the valgus stress test is pain or a feeling of instability at the elbow joint compared to the contralateral elbow. Different aspects of the UCL can be assessed by changing the degrees of flexion the patient's elbow is when the stimulus is given. So Griffin, how are you today?
Good, how are you?
Good. I hear you're having some trouble with your elbow. What's going on?
Yeah, I was about to pitch the ball and it just weirdly disformed and hurts a lot.
And they're on the inside of your elbow?
Mm-hmm.
Okay. What I'm going to do is called the valgus test.
Mm-hmm.
So I'm just going to take your arm here, and if you feel any pain, just let me know, okay?
Okay. Ow, that hurts.
That hurts?
Yeah.
Yeah, it feels kind of unstable there. Let me try it on your other elbow and see how that feels.
Okay.
Any pain there?
Not really.
No? Okay. We probably damaged your ulnar collateral ligament there.
Okay.
So you'll probably need to have surgery. It's called Tommy John surgery, but you'll be back to pitching in maybe about 9 months.
Okay.
Sound good?
You sound good.
Perfect.
Thank you.
Non-surgical options for a compromised UCL include rest, ice, and taking non-steroidal anti-inflammatory drugs. Proper rest and cool down following strenuous overhead throwing activities can help protect a person's UCL. After pain is eliminated, the patient will complete physical therapy in order to strengthen surrounding muscles in order to compensate for the weakened UCL. An individual becomes a candidate for UCL surgery if he or she does not respond to the non-surgical treatment modalities, or if the person wishes to return to overhead throwing activities such as baseball. During UCL reconstruction or Tommy John surgery, a tendon is taken from somewhere else within the patient, from such places as the forearm with use of the palmaris longus tendon, or from within the hamstring. Cadaver ligaments can also be used. The tendon is woven into a figure 8 and is used to reconstruct the compromised ligament. This is done by drilling holes into the ulna and in the humerus of the elbow. In order to increase the strength of the new ligament, any remnants of the compromised ligament remains around the joint. This diagram represents the procedure previously described. Phase 1 of the recovery process is made up of the first 6 weeks following the surgery. An elbow immobilization splint is worn for 7 to 10 days directly following the surgery. Therapy for the joint should consist of gentle range of motion exercises of the wrist, hand, and shoulder. Arm and shoulder strengthening exercises can also begin during the latter stages of this phase. Phase 2 of the recovery process begins 6 weeks following the surgery and lasts 4 to 5 months post-surgery. During this phase, the elbow can begin to be strengthened. However, the patient should avoid activities that place stress on the ligament. This includes activities such as throwing a ball overhead as in a pitching motion. The final stage of the recovery takes place from 5 to 9 months out from surgery. 4 to 5 months after the surgery, the individual may begin to throw a ball overhead, but should avoid the wind-up motion that is typical for baseball pitchers. 6 months after the surgery, the individual may begin doing an easy wind-up motion when pitching. 7 months following the surgery, a baseball player can begin to pitch normally from the mound. 9 months following the surgery, the recovery process is typically complete, and the individual may return to normal pitching duties and rotation. Surveys from individuals following the surgery show that 85% of the people receiving Tommy John surgery report better pitching outcome once returning to the game following the surgery. However, many people in the medical profession believe this is due to the focus on strengthening the surrounding muscles that takes place during the recovery process are to credit for the better pitching, not the ligament reconstruction itself. Exercises that you can do following ulnar collateral ligament surgery. These stretches can begin immediately after the surgery. The first one is wrist active range of motion flexion and extension. This can be done by bending the wrist of your injured arm forward and backwards as far as you can, like this. You should do 2 sets of 15 of these. Another exercise you can do is a wrist stretch. In this one, press the back of your hand on your injured side with your other hand to help bend your wrist. Hold this for 15 to 30 seconds. Next, stretch the hand by pressing the fingers in a backward direction. Hold this for 15 to 30 seconds. Keep the arm of your injured head straight during this exercise and do it for 3 sets. The next stretch you can do is for pronation and supination. This can be done by placing your arm bent at 90 degrees next to your side. First, pronate your arm by keeping your palm facing towards the floor. Hold that for 5 seconds. Then flip it over with your palm side up and hold for 50 seconds. Do 2 sets of 15 of these, both in pronation and supination, being sure to keep your elbow bent at 90 degrees by your side. Next, we'll be going over wrist strengthening exercises that can be done following ulnar collateral ligament surgery. Strengthening exercises can begin once you can go through all of the stretching exercises previously shown without any pain. All of the strengthening exercises can be done using common household items as your weight and can be progressed upwards as you strengthen your arm. So for this exercise, I will be using a can of dog food. So the first one is wrist flexion. Hold a can in your hand with your palm facing up. Bend your hand and your wrist upward and slowly lower the can and return to the starting position. Do 2 sets of 15 of these. Like I said, you can gradually increase the weight the stronger you get. The next exercise is wrist flexion and ulnar deviation. So hold a can with your palm facing up. Bend your wrist upward and turn towards your pinky side. Slowly return back down to the starting position of your palm facing upwards. Do 2 sets of 15 of these and gradually work your way up with the weight. The next one is forearm pronation and supination. Hold a can in your hand and bend your elbow at 90 degrees. Slowly return it back down. This may resemble a bicep curl if you're familiar with other strengthening exercises. Again, you can increase the weight of the can the stronger you become. Another exercise you can do is by using what's called a stress ball, that's any kind of squishy ball. For grip strengthening exercises, squeeze the ball and hold it for 5 seconds and then release. Do 2 sets of 15 of these grip strengthening exercises. Remember, whenever beginning a strengthening home exercise program, check with your physician and your therapist to make sure that you're doing it in a safe manner and not breaking any of the precautions or contraindications set forth after your therapy. Good luck with the recovery process, and you'll be back to your activities in no time. Many factors can impact a person's likelihood of experiencing a UCL injury. Client factors such as age, the sport or activity the person participates in, and the amount of rest the person has in between UCL strenuous activities such as overhead throwing pitching motion can impact a person's chances of sustaining a UCL injury. UCL damage can also come from imbalance at the elbow and shoulder during range of motion activities. Working with a physical or occupational therapist to address the imbalance issues can help this problem. There is a lot of information about ulnar collateral ligament compromise and Tommy John surgery available to the public through the World Wide Web. Because the condition is so common among baseball players, information on the topic is plentiful and easy to find.